Hi, my name is Michael Burgis and I'm the managing attorney of MB&A. If you're watching this video, it's because you're going to see a neutral panel qualified medical examiner in internal medicine. And I want to take a few minutes to have some general preparation notes and advice prior to that appointment. Now, most firms wouldn't do this, but here at MB&A, I want to be proactive versus reactive because I find that the better the information is going in, the better the report is coming out, okay? So let's take a few minutes. First, it's important you realize what the goal is from this appointment. The goal is to get a good, comprehensive medical report from the neutral state doctor, finding the greatest injuries to industrial causation, finding the greatest overall permanent disability, and the greatest need for future medical care. First off, fundamental bits of advice. Show up on time. Whatever you do, don't be late. This is the judge. This is the neutral person that's going to decide your case. You don't want to start off by being late and having this person upset with you. Inversely, you'll probably be sitting in their lobby for quite some time before the doctor sees you. It's very common. Don't give that person animosity or attitude. Again, this is the judge. We don't want to piss them off. Even if they're rude, they're condescending, they're belittling, kill them with kindness. This is the judge. We want the best medical report. There's two ends of the spectrum I don't want you to be on, and this deals with credibility. One end is the stoic, tough, sort of macho, I'm fine, life goes on, everything will be okay. Don't do that. The squeaky wheel does get the grease. If you say you have no injuries or that you're fine or it doesn't affect you in your activities of daily living, you have no impairment and your case is not going to be worth very much, if anything. Inversely, I don't want you to exaggerate. Don't say you can't do things that you can or that you don't do things that you do. Don't exaggerate either, because these doctors are going to say that you're exaggerating and it's going to affect your credibility in your case. Because remember that pain and especially internal medicine related symptoms is very subjective. Nobody knows the true level of pain or discomfort you're in other than you. So as long as you're credible, there won't be any issues. But when your credibility is undermined, now we can't believe that you really are in the pain you are. So be honest, fairly articulate everything. Now also, you might have a historian call you before the appointment, or the doctor might be going over, especially in internal medicine, they're going to go over your entire treatment history. And you got to assume they know the questions and the answers, or at least they have medicals that discuss prior treatment and symptoms. So they typically subpoena all your medical records through your Social Security. If you're at Kaiser or whatever it may be, they get all these records. All those records are sent to the neutral doctor. So for instance, let's say that you're seeing an internist because you're having significant upper or lower gastrointestinal issues. And the doctor asks, hey, have you ever had that before? You say, no, never. And yet 5 years before, there's a whole treatment record where you're on some medication because of that, like Prilosec because of acid reflux. Again, assume they know the answer to the questions. Don't try to outsmart them. Just be honest. Let the cards fall where they fall. It's okay if you have prior injuries, the same body parts or symptoms. That doesn't invalidate the workers' comp case. That just means that we have to show an aggravation of a pre-existing condition versus direct causation. But again, credibility is very important. Now, ultimately, the doctor might ask you questions about what your treatment goals are. And when it deals with internal medicine, less likely it's surgical, but if a doctor says, do you want surgery? And you say no, that will potentially negatively affect your case. Don't worry, you're not forced to have medical treatment that you don't want. Nobody can force you to have surgery you don't want. But what I don't want you to do is tell a doctor you don't want some specific treatment, because they'll write that in the medical report. I want to argue that you might need that treatment, whatever it may be, and that may be expensive. So I want to argue to the defendant that you might need some sort of treatment that's expensive. But if it's written in the medical report that you don't want it, it's going to sort of cut those legs out of that argument. So again, if you don't want some specific treatment, that's okay. Just tell the doctor, I don't want it at this time, but I'd like provisions for it under future medical. Now, I'm going to address some of the more fundamental issues in internal medicine. And a lot of this comes with weight gain. So on a typical orthopedic case, somebody, let's say they have a bad orthopedic injury like a back, and they can't work out like they used to. Now they're probably depressed. Sometimes they're now eating more calories. And typically with catastrophic injuries, especially orthopedic, you'll see significant weight gain. Well, that weight gain can cause significant internal complications. You can get diabetes, high cholesterol, high blood pressure, a whole host of things associated with weight gain. So if you have gained significant weight and you believe it's because of your work-related claim, this is important. See if you can roughly estimate how much you weighed prior to the injury versus how much you are today. If we can show that weight gain, and we can get that to be found industrial, then the compensable consequences of those weight gain, like hypertension, diabetes, sleep apnea, all of these things can potentially be linked. Now also remember this, you're seeing an internist, but don't forget to discuss all the orthopedic pain and symptoms to all those body parts, all the stress, depression, and anxiety. Just because it's an internist, don't hyper-focus on internal medicine. Make sure this doctor has a clear picture of all your industrial injuries, whether that be orthopedic, psychological, neurological, rheumatological, whatever it is outside the scope of that physician's expertise. Again, the goal is that this doctor just generally likes you, feels sympathetic for what you're going through, wants to link everything to industrial causation, and writes a really good report finding the greatest amount of disability to all of those internal conditions, the greatest need for future medical care. Now that's the evidence that I need to really argue on your behalf. So again, when you see this neutral doctor, to summarize everything, be on time, be polite, be honest, don't minimize, don't exaggerate. Fairly present all prior injuries, fairly present your current pain and symptoms, but remember that those pain and symptoms are based on what's called the AMA guides, and they're based upon objectives, subjectives. Objectives are like the diagnostics, subjectives are your personal pain, and your impacts on those activities of daily living. So if you have any impacts on those activities of daily living, you must let them know. Ultimately, again, this is just a general video. Avoid taking pain medication if you can. Not that I want you to be pain unnecessarily, but I do want this doctor to see you at your worst. However, please take any medications that you need to, especially on an industrial basis like high blood pressure, that type of stuff, but make sure that the doctor knows exactly what you're taking and when you took it. For instance, if we're asserting that you have high blood pressure now, but you just took pain medication or hypertensive medication, then ultimately it might look like you don't have hypertension when you really do without the medication. So it's important the doctor knows about all that as well. Again, general prep video. I hope this video was helpful. If you have any questions or concerns on an individual basis, our office can, of course, go over that on an individual basis with you. The better that report is coming into us, the better the evidence is. And I look forward to representing you and getting you a great settlement and a happily ever after.